Hi, good morning students. We will see the last part of the give reasons. The first one, in polyhydramnios, the membrane is rupture prior to or at the time of labor starts. When there is sudden escape of vaginal fluid, that means when there is a sudden escape of fluid vagina, there is a chance for escape of umbilical cord as the cord collapse. To prevent this, ARM is done only at the end of first stage in the polyhydramnios. Per-vaginal examination determine the situation of placenta is dangerous and should be done in operation theatre in case of APH. It is not PPH, it is APH. Inserting a finger into cervical canal or applying pressure to the vaginal fornices may induce profuse hemorrhage immediately or with a few hours, which may be uncontrollable. So it should be done only when all the equipments are ready for resuscitation of the patient. Contraction not applied when the fetus is macerated or preterm. Tensile strength of the cord is reduced in these both cases, so there is chance for breakage of the cord. Babies should be laid on sides after the feeds. This will be help to prevent aspiration as the babies are not able to spit the vomitus. Placenta should be delivered during contraction. Pulling of the cord or tension applied to the cord without contraction will lead to acute uterine inversion, which is a life-threatening complication. So no attempt to deliver the placenta when the uterus is not contracting. Episiotomy indicated in conducting premature labor. In premature labor, the cranial bones are fragile, so vulnerable for fracture. This leads to intracranial hemorrhage. So, to prevent the intracranial hemorrhage, liberal episiotomy indicated in premature labor. In labor, the contractions are painful, but in pregnancy, they are not painful. In labor, the pain caused by uterine contraction, dilatation of cervix in the first stage, and in the second stage of labor, it is because of stretching of vagina and pelvic floor to accommodate the presenting part. But in pregnancy, contraction does not cause dilatation of cervix or uterus, so there is no pain for the contractions during pregnancy. During postnatal period, necessary to check the fundal height every day. Fundal height is the clinical method to evaluate rate of involution. The fundal height is reducing 1 centimeter or 1 finger breadth per day, it indicates the involution is taking place normally. It has to be checked at the same time every day. Make sure that mother has passed urine and stool, otherwise it may give a false result. If fundal height is not decreasing, it indicates subinvolution, and this should be treated by finding the reason for subinvolution. Sedative like opium should not be used in preterm labor. Opium drugs can cross the placenta and will depress the respiratory center. In preterm baby, the respiratory center is not well developed. So, if we administer opium drugs, again it may cause respiratory center depression. That will lead to asphyxia, especially in preterm baby. Hypothermia is common in newborn baby. The infants have a large surface area, that means surface area ratio, body mass ratio potentiate the heat loss, especially from the head, which comprises of 25% of infant size. Infant subcutaneous fat layer is thin and provides poor insulation for allowing the transfer of core heat to the environment and also cooling of the blood. In addition to the heat loss by evaporation, further heat will lost by conduction when the baby is in contact with the cold surface, by radiation to the cold object in the environment, and by convection caused by current of cool air passing over the surface of the body. Thermal regulation center is not well developed in newborn and also because of large surface area per unit of body weight. These all things together will cause hypothermia in newborn baby. All pregnant women should weigh from the 20th week of gestation. Rapid weight gain is the early manifestation of preeclampsia, and static or reduced weight gain is a sign of intrauterine growth restriction. So, if the woman is gaining weight adequately, the sign of fetal well-being. Do not encourage the woman to push during the first stage of labor. Early pushing may cause cervical edema, and this may make the labor difficult, and also early pushing may lead to exhaustion of the mother, so there will be only less energy for active pushing in the second stage of labor. Papillary infections are more common in patients with forceps and delivery and episiotomy. Vaginal wall may turn during forceps delivery, episiotomy extent, bruising and trauma of the urethra, and also moisture at the perineal area is a ideal growth of the anaerobic organisms. Labor is prolonged in phase presentation. It is because phase is an ill-fitting presenting part, and therefore it does not stimulate active uterine contraction, and also facial bones does not mold. Sulfonamide is not advised close up at the time of delivery because it can produce neonatal jaundice. Placental abruption with concealed hemorrhage, mother have acute pain. Blood which retained behind the placenta may be forced into the myometrium and infiltrate between the muscle fibers. It causes damage of the uterus, edematous and bruise. Concealed hemorrhage can cause uterine enlargement and extreme pain. LSCS prefer than classical CS. In LSCS, less muscle and more fibrous tissue, so which decrease the risk of rupture in subsequent pregnancy, and this heals more rapidly than classical cesarean section. Thank you. Thank you for listening.